Hi everyone, I am Gauri PS, lecturer, Department of Radiography, Global College of Allied Health Sciences. Today we are going to look about the topic pulmonary angiography. So it is a method of angiography. It's a type of an angiography study. It's called as pulmonary angiography. The pulmonary angiography is a special X-ray test or an examination that is used to visualize the blood vessels in lungs. That is mainly to detect the blockages such as pulmonary embolism. That is a blood clot in the lung. So, CT pulmonary angiography is a medical diagnostic test that is employs the computer tomography to obtain an image of the pulmonary arteries. This pulmonary angiography in CT was introduced in the 1990s as an alternative to ventilation or perfusion scanning, which relies on a radionuclide imaging of the blood vessels of the lung. Because of its minimally invasive nature and high sensitivity and specificity, the computer tomography pulmonary angiography has evolved into the first line imaging study for the evaluation of suspected pulmonary embolism. This uh, This was introduced in 1990s for alternative, that is alternative for ventilation or perfusion scanning, and it will be relying only on the radionuclide imaging of the blood vessels in the lung. That is, it is regarded as a highly sensitive and a specific test for pulmonary embolism. So this is the pulmonary angiography machine. That is the same CT machine that is used in angiography procedures, but the technique we use will be differs. So next, in computer tomographic pulmonary angiography, it is conducted by the radiologist and that uses the x-rays and the injection of the contrast eye through a catheter to allow the visualization of the blood flow, and this helps to identify the blockages in the lungs pulmonary arteries, and usually this procedure will be taking about of 1 to 2 hours to perform. So this is the correct method we use, that is 1 to 2 hours will be taken. So there are several indications. So what are the indications? That is to diagnose the pulmonary embolism, pulmonary artery aneurysm, aortic dissection, aortic overloading, left ventricular stress, teratology of Fowlett, vascular malformations in lungs, tumors related to the blood supply. So, what are the contraindications will be there? The contraindications will be if the patient is allergic to the contrast, they will not be taken. So, in the case of suspected pregnancies or any of the surgery process, we will not be doing this pulmonary angiogram method. So, next we are looking about the patient preparation. So, what are the patient preparations? That is, the patient will be advised to do fasting for 6 to 8 hours, and a consent form will be signed either by the patient or the patient's attendant before starting the process, and allergic reactions will be checked properly, and the IV line will be inserted for the supplying of medicines. Usually, before the scan, we will be reviewing about the patient's histories, medications, and allergic reactions. And it is iodinate based contrast will be used. So, we have to check the allergic reactions. Then, 4 to 6 hours of fasting is recommended compulsorily. And we are removing all the metallic objects from the patient's body. And the technologist will be explaining the procedure and ensures that whether the patient will be comfort. So next is about the technique. What is the technique? That is, the patient will be lying on the CT, that is the angiography table, and the local anesthesia will be administered in the groin region or on the neck, that is to numb that area. Why do we numb that area? So that the patient do not feel any pain of insertion. Next, a thin catheter will be inserted into the vein and will be guided through the heart to pulmonary artery under the fluoroscopic guidance. And then an IV line will be inserted to inject the contrast dye into the pulmonary artery, and this highlights the lungs vessels on the x-rays. During the insertion of or the injection of the contrast, the patient may feel a warm or a metallic taste, and the scanner will be rotating around the patient's chest and will be capturing the high resolution images, and the rapid images will be taken as the dye will be flowing through the lungs arteries. So the patient may be asked to hold their breath for short moment, and they will also take 10 to 15 minutes. And this will be usually 10 to 15 minutes, and the patient will be completely painless. And the patient and the radiologist will be closely monitoring throughout the procedures so that they can find any blockages or abnormalities found in the patient. So after the completion of the process, the catheter will be removed and the close and the pressure will be applied to prevent the bleeding. So after the CT pulmonary angiogram, we should the patient should be monitored for a few more hours. Uh, the patients we should resume the normal activities immediately, and we should ask the patient to drink a lot of water, so plenty of water to flush out the contrast from their body. Usually a mild warmth or a bruising at injection site may occur and will be fading very quickly, and the radiologist will reveals the images for the pulmonary embolization or the blockages, and this detailed report will be ready within a few hours, and the patient will be asked to stay hydrated. So the complications will be bleeding, heavy bleeding, bruising at the puncture site, or allergic reaction due to the contrast, or irregular heart beatings, or shortness of breath, then pulmonary artery injury, etc. Then it is a golden standard for pulmonary embolism, that is, it is a directly filling defect, and its diagnostic always access the right heart strain. So it is compulsory to be checked thoroughly the patients. So we do not take the cause, that is, if there are any indications such as a sudden chest pain, unexplained hypoxia, or a suspected pulmonary embolism with high well scores or elevated D dimer, so it is recommended to check the patient's health conditions and make it convenient to uh, cure the patient at any time. So that's all for today's class. Thank you.